This is Carol. Her husband Jeff has a bipolar disorder and severe physical disabilities and has been in care for 21 years. Then, in November last year, Jeff had his continuing care funding cut.
I know it can be withdrawn. I've known from the beginning it can be withdrawn. But for what reason? My husband's worse than he was eight years ago. And I'm just a strong person. But this has absolutely got me to rock bottom.
But Jeff might have had a different outcome if he'd happened to live somewhere else than his particular part of Berkshire when he became ill. A which survey of all the clinical commissioning groups which oversee local NHS healthcare found it's a bit of a postcode lottery, and the results can even vary within the same region. In Salford, patients are almost 7 times more likely to get the funding than those just down the road in Stockport. In Wolverhampton, they're 5 times more likely to get it than their neighbours in Sandwell and West Birmingham. And in Richmond, they're 3 times more likely to get the funding than those in nearby Ealing. So why is there so much variation? We spoke to a lawyer who deals with these sorts of cases.
There's an assessment tool which is used across the country to assess those people that are eligible for continuing health care. The assessment tool is very subjective, which leads to disparity across the country. So one person's view of who is eligible for this funding differs to another.
Some clinical commissioning groups blame differing demographics for the variations, and the Department of Health and Social Care are publishing a green paper this summer setting out plans for reform of adult social care. But in the meantime, Carol has just received a backdated bill for 3 months' care. She's appealing but has no idea what the outcome will be.
It is potluck and it's very, very distressing. I just think it's wrong. Everybody's equal and where they live is irrespective of the care that they should be provided for.
Carol spent 40 years caring for others as an NHS nurse, midwife and health visitor. She's spending her retirement trying to ensure her husband continues to get the care that he needs. Ruth Liptrot, 5 News.